Refugee Health Education Experience, a community-based approach to serving multinational patients, presented by David Savage with the University of Texas Medical School at Houston, as well as with the Houston Galveston Albert Schweitzer Fellowship Program here in Houston.
Well, good morning, everybody. So I'm David, and what I want to tell you about is a project I've been working on for nearly a year. And I'm going to start by giving you a little information about how refugees are resettled in Houston, tell you about the agency I worked with, and then tell you about the plan that we implemented with my agency. So refugees are initially resettled through the UN High Commission for Refugees. And currently there's over 15 million refugees worldwide. And of those, just a very small sliver, 76,000, are resettled to the United States every year. And Texas is the second largest recipient of refugees in the United States. And we're the largest city within Texas that receives refugees. And refugees come from all over. I've listed some of the countries of refugees that I worked with this year, but refugees are really coming from all over the world and being resettled into Houston. So my project this year was working with the Alliance for Multicultural Community Services, or just known as the Alliance. And it's one of many agencies in Houston that resettles refugees. And their task is to, in just 6 short months, make a refugee or their family self-sufficient, which is an incredibly immense task, because they're taking people who don't know much of anything about the United States and our social system, and many times they don't even speak English, and they're trying to make them self-sufficient so that when cash assistance ends in 6 months, these people can support themselves and their families and can get by without needing an agency like the Alliance to be there by their side. And so at the beginning of my project, and this was a year-long Albert Schweitzer Fellowship project that I designed early last year. And at the beginning of it, I wanted to kind of assess the needs of my community. So I had focus groups where I sat down with the population I was going to serve, asked them lots of questions, and got a lot of really good information. But the 3 things that I found were just consistent barriers for every group was, 1, language. And this came up again and again. If you want to get Medicaid, if you want to get a gold card, or Harris County eligibility as it's now called, for healthcare, you should fill out an application in English or Spanish. Well, none of my population speaks or reads those languages. Then once you get eligibility on either one of those services, let's take gold card for example, the patient is expected to call a phone number where the person on the other end of the line speaks English or Spanish to make an appointment for clinics that they can't walk into. So that's another barrier. And then a third thing is that patients get paperwork sent into the mail to them in English and Spanish or maybe Vietnamese. Again, they don't read or speak any of those languages. So there's just barriers again and again and again. And then with the clinic visits, unless there's a language line or a language phone available, a lot of times the burden's on the patient to bring a child or a neighbor to do the interpretation for them because the clinic doesn't provide that. So language is huge. Transportation, most of the refugees do not drive. They don't use the bus system because they're uncomfortable with the bus service in Houston, and they can't read the signs at the bus center. So they're kind of limited to where they can ride a bike to, or where they can walk to, or where a neighbor, when the neighbor's free, will take them to. And the third thing is cultural, and I've especially seen that this spring with the mental health classes that I've been offering, because a lot of people in this population need mental health care, but a lot of them are very hesitant to seek it because of the stigma that comes along with that. So the goals of my project were as follows. I wanted to create an elective at my school where students, medical students who would participate in this project with me could get credit for it. And we succeeded in doing that. The curriculum committee was enthusiastic about this project and was willing to give students credit for participation with my project. Then I wanted to host community-based classes on weekends where we would sit down and talk about key topics that the refugees said were very important to them. And then I wanted to run health fairs at the Alliance's offices. And then finally, this was kind of a late goal, was to create a video that would explain in each person's individual language how to walk through and fill out that Harris County eligibility application in their language. So even if they couldn't read the form, at least somebody could auditorily walk them through the process of filling out the application. So now I want to tell you a little bit about what we got accomplished this year. So first of all, with the community-based classes, in total, I was able to offer 16 classes over the course of the year, 9 in the fall and 7 in the spring. In total, nearly 200 refugees, either new or recurring, were served through these classes, and the topics we covered, including applying for a gold card, personal hygiene and cancer screening, and just a hodgepodge of different topics that the refugees were interested in regarding preventative health. And then all spring long, we've been doing mental health care. And I've been collaborating with some psychiatrists from Baylor College of Medicine who have been really, really helpful in this task in helping teach people about adjustment, depression and trauma. Of course, I couldn't have done this without the people who volunteered and helped me on the weekends. And so here's a Bhutanese class with some of the volunteers talking about preventative hygiene. And then here's one of my favorite interpreters, Abraham, talking about hand cleanliness and preventing the spread of the flu. And then these are some pictures from our most recent classes in the last month. The top picture features some of our Bhutanese clients who, it was one of our most interactive and most fun classes of the spring because they just really opened up as we were talking about depression and trauma in their community. And then the class below it was just from last weekend, the all-time best class of the year. We had 26 refugees, 6 medical students, and 3 mental health professionals who all collaborated to make it a really outstanding kind of close to the year with our last class. And then I had volunteers helping me every step of the way, and students turned out again and again for a little more than, acknowledgement on their dean's letter that they had participated, because they really had this sincere interest in the global community that lives right among us here in Houston. With the health fairs, I've had 3 health fairs so far, with one more planned for the weekend of April 13th, and we served 180, 205, and 103 clients at each of these. So in addition to the screening for blood pressure and blood glucose and measuring people's vision, we also had kind of a unique aspect to each fair. So at our first one, we had a physician who did some very thorough histories and physicals. At our second one, I received funding so that we could offer up to 170 flu vaccines during flu season for our clients. And then at our most recent fair, we had an audiologist who volunteered his time, brought his equipment, and did hearing screening. And we also had the Houston Food Bank who was there doing nutrition education for our clients. And the UT Dental students collaborated with us in September and will be back with us in April talking about dental hygiene and helping educate people about that important aspect of their life. So these are some pictures from our November fair. This is Belinda the Bee, courtesy of the TMA Foundation. So the bee suit was really popular, but more importantly, they provided nearly $2,000 so that we could provide the flu vaccines to these clients. We also had a lot of donations of Kleenex and toiletries that we were able to give out to the clients at the health fair, and that was largely attributable to my site mentor, Lori, who kind of rallied the staff and got them to donate these supplies so that we could give them out to the clients. And then at our most recent fair in January, we had some clever students doing some vision screening with iPads, and we also had the Houston Food Bank in the bottom right doing some education with mock plates about what a balanced meal looks like and how that fits into the life of these families that came and visited with us at the Alliance that day. So the conclusions I have from this is, one, I've been very humbled in this process by the volunteerism of my peers. And by setting up this project, I've created a framework where students could just come and participate and plug in as they had time. And they did so en masse, and it was just immensely gratifying to see them work with me to achieve this goal. Also, language, transportation, and cultural barriers are going to remain huge obstacles for this population. But I've come across collaborators in the last few months who have really been willing to help me with some of these things, especially language and mental health and getting people plugged into community clinics nearby where they live. And then last of all, mental health, I've discovered, is just a really, really big obstacle for a lot of my clients. It's something that needs to be addressed immensely, but because it's specialist care, you have to get to the PCP first, and there's steps to do that, which are very hard to overcome, and then you have to overcome the stigma of wanting to see a mental health doctor. So a lot of great things to continue working on, but I'm hoping that the students who have worked with me this year, some of them might want to champion working on it next year with me kind of guiding the way and helping them with funding so that they can make that possible. So I just want to thank some people that have been immensely valuable to this, my mentors, my collaborators, and then also for funding. So the Albert Schweitzer Fellowship kind of provided a framework to make this project possible, but then the TMA Foundation and also the Alliance, through their funding, helped out a lot along the way with interpretation and different services that I needed to make this project successful. Thank you all very much.
We do have time for one question if there are any.
Yes. No, I don't. I think I would settle for just having mental health professionals who had a interpreter intermediary who understood the cultural barriers. And I think Abraham's a really good example of that. He's not only a really, really good interpreter, but he understands kind of the cultural aspect and then the social issues that affect the clients. So if he could describe that to the care providers, I think that would be helpful.
Thank you very much.
Thank you.